Much of the medical focus lately in Connecticut is rightly on the COVID crisis, but the normal medical emergencies haven't stopped because of the coronavirus, and essential medical procedures continue to be performed. Here to talk about this is Dr. John Grady-Benson. He is the physician-in-chief at Hartford Healthcare's Bone and Joint Institute. So thank you for joining us, Dr. Grady-Benson.
Thanks, Nicole. Good to be here.
My first question for you is, what types of safety measures have been implemented when it comes to essential surgical procedures post-COVID?
The important thing for people to know is that we have a COVID-safe environment. We've been doing emergency procedures all throughout the COVID crisis effectively and safely. So we have specific protocols to make sure patients are safe. We have a large group of multidisciplinary physicians, nurses, care providers, and infection prevention specialists who have set apart categories of safety to make sure that we are not performing surgeries that could be postponed safely. On the other side of it, we want to make sure that people aren't suffering at home and not having a good result by postponing their surgery. So everyone's wearing a mask. We're doing a social distancing thing that throughout the entire care cycle. Hand washing, obviously, is something we do in the hospitals all the time anyway. Appropriate respiratory etiquette, sophisticated testing of every patient, screening constantly of all staff coming to the hospital and all patients, and then making sure that we're following data very carefully to know that as more and more surgeries become necessary and essential, we're always putting safety as the #1 priority.
And doctors, you can imagine many people are still a little fearful returning to the hospitals for essential surgeries. So what would you say to those patients?
First of all, I understand your fear. This is an uncertain and fearful time. Having said that, we have enough data now in the last 2 months to know that the patients who are coming to the hospital for the emergency procedures have been kept safe. We don't know of a single patient in the musculoskeletal health world who obtained COVID by coming to the hospital. We started doing some time-sensitive and essential surgeries last week. We're keeping a very close track on those patients. Of the survey of 40 or so patients that we operated on last week, there has been an unbelievable and overwhelming positive support saying that they all felt safe, they all felt cared for, they were extremely impressed with our safety protocols, and we're going to continue to follow that data very closely on a daily basis.
All right, a lot of information to absorb, but a lot of great information as well that you just passed along to us. So thank you very much, Dr. John Grady-Benson, Physician-in-Chief at Hartford Healthcare Bone and Joint Institute.
Thanks, Nicole.